International service has actually been around for over 100 years. You had faith-based missionary service 100 years ago. Then after the World Wars, we had post-war Reconstruction. And in the last 50 years, with the founding of the Peace Corps 50 years ago, we saw the connection between international service and peace and development work, and recognizing that global development happens from the ground up, if you will, from people working together. So over the past 50 years, we've seen a proliferation of the different forms. Peace Corps really helped to be the flagship program, if you will, in the United States. But we've seen nonprofit programs that have been developed. We've seen higher education develop international service learning programs. And we've even seen for-profit providers that have entered the field. And it's not just in the U.S. It's not just about U.S. citizens going abroad. This is a global phenomenon. We see across the range of volunteers in these programs. It's everything from students in high school to retired older adults. Okay, so when you think about that stretch of volunteers, you're going to get different outcomes for different groups. And what we see is that one outcome that's constant across all of them is an increased international awareness. When you go and you live in a host country, you're welcomed potentially into a host family's home to live there over an extended duration. That immersion, it changes you. It changes your perspective of the world. It changes your perspective of perhaps even of your own nationality. So among young adults, we see career intentions change, and actually our research supports that. So younger adults are more likely than to have an interest in development-oriented careers or actually international careers. Older adults, not so much. Instead, for them, it's very much about learning about others and increasing their capacity to interact with those who are different from themselves. We also see that volunteers increase their international social capital, and this particular finding relates to building connections with people that are in other countries. Research shows that international volunteers will stay in touch with the program staff that helped orient their experience. They'll stay in touch with the community members that they met in host country, and they also stay in touch with the other volunteers that they may have met while they were there. And it's not just of a friendly nature. Sometimes it's really more of a civic nature. So they're helping connect those community members with resources back in their home country, potentially, or they're sending money to that host community. The second area of this international social capital finding is how those connections are actually used. And so whereas duration and the community requesting the services predicts the development of the relationships, using them is predicted by one variable, and it's the language proficiency of the volunteer, which again makes intuitive practical sense. If they want to take those connections and link them with other people, perhaps in the United States, or they want to connect them into other resources, they have to be able to use the language. What we were surprised about in terms of these findings is that we thought immersion would matter, that living with a host country family would lead to more connections and then also lead to more leveraging. We also thought that training, in particular on the host country, many of these programs, if not all, offer some sort of orientation to the country and the culture, and that didn't bear out. So it's interesting that it comes down to more of these individual kind of characteristics, the language proficiency, duration, and then the community being on the ground and requesting these services right from the beginning. Our next study is in partnership with Dr. Ed O'Neill from Tufts. He's also the founder and director of OmniMed International, which is an international service organization focused on community health. In this particular project, we're focusing solely on the community health impacts, not on the volunteer impacts.